Growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, I'm Dr. Steve Rasner, and welcome to another week of the Lionhearted podcast. This is going to be a good one. So right off the bat, I'm telling you this for a multitude of reasons. I've been really busy for a couple weeks, and a lot of things have happened that I want to talk about. Secondly, it's after work. So you know what I'm like after I work. I'm usually mad about something or happy, and it's probably both tonight. So let me get into your head. You're on the way to work. It's the weekend, and you have a minute to, I'll see what Rasner has to say this week. I'm going to try to make this and the upcoming podcast. When I do this after work, I don't edit this out, Beth, because this is real. I don't speak as well because I'm probably fading. But I'm not, on the other hand, I'm not fading because I'm full of ideas tonight. I'll just talk fast and probably say things wrong. I went to a great seminar this weekend, and I am not saying this to you because they asked me to. They would never ask me to. I'm talking about Bill Strupp, Mike Brum, Clearwater, Florida, the 2-day predictable complex case Crown and Bridge seminars that they do. They do one in Clearwater, Florida, which I just attended, and they do one in San Diego, which you still can attend. They don't even know I'm saying this. I'm not even kidding. They're too big, and, I'm not petty enough to have to plug my friend's course. Certainly he doesn't need me to. It's a good course. Let me tell you a couple things about taking a course. Never measure yourself against the person speaking. And what you should do is try to see how you can assimilate as many good ideas as you think they have into your present situation. And, the cool thing about Strupp and Brum is, number one, Strupp is an amazing entertainer / educator. It's hard to do that. And Mike's very much like him as well. Maybe he defers a little bit to the king, as we all would. Even I would. Haven't been out speaking way more than in length of time than Mike does. But Mike does a fabulous job with his part of it, which is technique. I'll give you one gem. It's not even a gem. It's a thought process that they reminded me of when I was there. And that is, now get this, right? You're going to love this. They don't really do any direct clinical dentistry. So what's that mean? Well, for Bill, if you need an occlusal, if you need a two-surface resto, it's either going to be gold or Lissy Press. I'm serious. And he's been like that since 1980. And I know it's a fact because Bill used to describe me as one of his favorite and most productive, quickest learned students he ever had, because he used to have this newsletter where he would write things, and he used to write about me because I would give him input as to the impact his course had on me. Just stay with me. Back in 1990 something. It's true. I took his course, and my practice, that wasn't my goal, what I'm about to tell you. My practice increased $500,000 in 1 year. It's a true story. Just by increasing my recommendations and treatment of gold inlays, onlays. So I'll say it again. Bill does not do any direct dentistry. He does not do fillings. And I didn't ask him, but I'm pretty certain that Mike is exactly like him with maybe a few exceptions. I'm pretty sure I'm spot on. So think about it for a minute. And maybe you love it. There's courses upon courses out there. How to do beautiful direct composite restorations under the rubber dam and making magnificent secondary and sometimes tertiary anatomy in these direct composites. Look, I'm the Lionhearted Dentist guy. So I can only give you, my audience, what it is I like and share with you. And it's hard for me to believe that that would not become very old for most of you. I don't care how many direct, beautiful restorations you've done. And maybe you've done them for now 10 years and you love them still presently. Well, guess what? Your career's not 10 years. It's much longer than that. And to be quite honest, if indirect dentistry is done properly, it's hard for anybody to argue ever that it's not superior to direct care for a multitude of reasons. Remember what I just said, if it's done properly. And so I believe that. And I had forgotten that Bill said that. I have actually forgot that they even believed in that. I'm serious. I haven't been there probably in 10 years. It was an absolute rejuvenation for me. Oh, just on that. And that wasn't even when he had not even taught his techniques yet. It's just the thought. You think about this right now. When you go into your office tomorrow or on Monday, and you're looking at, and I know when you're back in the fields of first line dental care, it's hard to just implement what you hear me say or what you heard a speaker say at a course on a weekend, because it's different. Everybody, there's always an exception, isn't there? And Mrs. Smith sitting in your office chair on Monday morning, and she has a moderate-sized MOL on an upper right first molar. Ask yourself, I'm serious, if she would pay for it, would that patient be better off with a indirect resto, meaning it was made in a lab, or, those of you that have CAD cams and mill your own restorations, and it was done to the best of your ability, would she be better off in terms of longevity with that, or would she be better with your best composite technique or whatever you're placing you could come up with? I just don't think there's any question. I believed that back in the 90s. I still do. But things change over time, and we somehow fade away from belief systems that we acquired over the time. And, let me tell you something. I did an enormous amount of indirect gold restorations in the 90s. I've even lectured about it before I took this course this weekend. And to this day, I have patients that are 88 years old and younger that I did those restorations on 30 years ago. I still do them, by the way. I lost that thought process. So I think I just nailed it. Think about it again. You're going in next week, somebody's in your chair, and maybe they don't need a crown. They need a 3/4 type of restoration, I'll say. Would they be better off? Money wasn't an issue, and you know the problem. The problem is money is the issue to you. With Strupp and Brum, they believe so much and for so long in that philosophy that it's nothing to them. They don't hesitate. They're not weak. They're not squirrely. They're not worried about the patient's insurance. They're worried about providing a solution for a tooth that lasts the longest. Who wouldn't want that? And you know what? I didn't keep all my patients from the 90s. I'm sure I lost a lot of patients that really thought all I cared about was getting in their pocketbook. And that's always the case, but it's the case even today. You lose patients that don't understand your motives. I was so enthralled with my results. So after I saw these patients 6 months later at a hygiene visit, or a year later, it just fueled my want to provide such restorations. I'm rejuvenated to want to do it again. Those guys today use way more Lissy press probably than gold. I'm still good with gold. And whether you know this or not, you can prepare up to through the premolars in many cases and hide the gold if that's the... Now, I get some patients are just going to resist it, so you'd have to go to a different type of material to restore with. And I didn't even intend to talk about that much today in this podcast. Another thing that happened was that I realized how popular this podcast was. And I'm smiling if you're looking at me, and you can probably tell, but I didn't know. I mean, I don't know. And when I was there, I literally lost track of all the people that came out and went out of their way to come up to me to tell me, hey, thanks for the podcast, blah, blah, blah. Keep it up. I remember, and they were like quoting things I'd said, and it was pretty hysterical and inspiring. So I guarantee you that the podcasts are going to last another 2 to 3 weeks. I'm kidding. They're going to last more than that. But it did refresh and inspire me. So, before I get too lost in time, and I can already see I got to break this one up into two. Again, thank you to all you that follow me. I mean, honestly, it really did mean, it touched my heart how many people came up to me. I had no idea. And many of you came up to me just because you heard of me. And I'm looking at you right now with a big smile. And those of you that, haven't met me or will never meet me, it makes me want to have one of those courses I keep telling you about, a live course. I'm pretty sure that's going to happen. Because once I get a thought in my head, so my thought is having either a 1 or 2 day course. Maybe I'd have a guest speaker or two, but I would be the bulk of it on a live Lionhearted weekend or one day. I can't make up my mind. I'll take your input for it. Last thing I want to say was about, and I am going to have a guest speaker. I'm going to have 2. At some point, I hope in the next month, maybe 2. And those 2 are going to be Strupp and Brum, probably separately. Because I like them so much. And I know most of you that listen to me, I think you like me. And I'm pretty sure you'll like who I like. Hey, they're friends of mine. I want to introduce you to a friend of mine. That's like a mafia thing. All right. I'm obviously getting tired. Here's what I came up with tonight for the rest of it, which is about 12 more minutes. Stuff I know you think about and you're not sure what to do. And I want to say it just like that. I hope Beth entitles my podcast that, because I could have made it sound more sophisticated, but I don't want to. Stuff I know you think about and you're not sure what to do. You ready? Some of this might be a little redundant, particularly the first one after last week or two's podcast. The staff member you hate. You hate them. You have a staff member that you can stay away, you can put it out of your mind sometimes for a month. You can put up with them for a month, but you don't like them. They stand out amongst all your other staff members. And I know I did discuss this a few weeks ago. But obviously something happened to me today to make me say this. And I really don't care if they watch. I hope they do watch it. I hope they want to confront me. I should be man enough to just do something about it because I tell you to. Everything I tell you to do or suggest that you do on these podcasts comes from something that I've done that made my life professionally and personally better. I said to you, I remember, if somebody can alter you physiologically, and what I mean by that is it's what I mean. They make you mad. Your blood pressure increases. Sometimes they can do that and they don't have to even say anything. That's really a sign you got to do something. I am going to do something. I'm in the stages of planning it. I mean it. And it's going to cost me, it's going to make my life harder when it happens. Initially. Like it has the other 2 to 3 times in my 40 years that I did the same thing. A career goes by very fast, guys. And it's very easy all of a sudden to turn your head and be back and this person's been with you that you really didn't like, I don't know, not long after you hired them. But they were good at it. A great dental assistant. I don't think this can apply to hygiene. Because if you really don't like your hygienist, it's too pivotal in what happens from a hygiene space in your office in terms of cases. So anytime in my career that it was from the hygiene department, I immediately reacted and terminated the person. First of all, I always had a backup hygienist. As long as I can remember, I've had two. So it's easier to make that move, right? So you can have somebody in hygiene that you don't like. Anybody that you don't have a chemical connection, a good relationship with, cannot be handling money. And when I say that, I mean presenting cases, the financial person, onward and onward. They could be a dental assistant that's just exceptional. Wink, wink. I wasn't looking at the camera when I said that. And maybe they do stuff that irritates you, like they never say goodbye. So, this is definitely going to be a two-part series, by the way. They should say goodbye. Your staff should say hello and good night, Dr. Such and Such. It's a sign of respect. It's minimal respect. Are you okay with them not saying hi or goodbye? You walk in the morning on Monday or Wednesday or whatever day of the week, and they don't say, hi, good morning, how are you? No, I'm sorry, staff. You don't like this? Maybe it's our turning point with the Lionhearted. I hope not, because I fight for you guys all the time. I'm going to fight for you tonight. If I get to the point, maybe I'll make it to the next point. So I do get to it. They don't say goodbye. It's simple as that. They're so arrogant that they're so unappreciative of this position you gave them. When I say that, I mean who they get to work with, the amount of money they make, the equipment, the supplies, the quality of your work. Yes, that is part of the benefits of working for a good quality dentist. Absolutely is. It can't just be money. That's not a relationship. I'm talking to staff right now. So, if you hate them, you got two choices. You have a sit down, and whenever you have a sit down with somebody that you're thinking of terminating, you have to let it all go. You can't keep anything in, because if you really mean it, that's the last barrier, that talk between them working for you and not working for you, then it's your fault if they stay and they keep doing the same thing. You got nothing to lose. It's like breaking up with a boyfriend or girlfriend. You got nothing to lose if you meant it. And yeah, so if you're not going to say that, then just replace them. And you will struggle. I've done it. It is such a liberating moment of I'm telling you, of both your professional and your personal life. It's professionally liberating because they're not there causing you hypertension. And it's also liberating because you feel like a principled person, that you stuck to your guns. And I know it's frightening because it's easy not to change. You already have enough issues to occupy not your mind that you don't want another one. You mark my word, when you talk to me, very, very soon, mine will have been solved. Okay, number 2. I have 7 of them written here. I'm going to do 1 or 2 more. On the same line, I'll give you a good one, and then I'll end with a not so good one. Somebody on your team asks for something in their schedule that changes their availability to you. They want to coach, I don't know, let's see, we're in the middle of fall, beginning of fall. They want to coach a team, which means they can't be in the office after 2:30, 3 days a week. Woo, that stinks. I get it. They want to take a course. They might even want to take a course in something not related to dentistry. They want to start thinking about getting out of dentistry. Stay with me on this. Maybe they're just borderline burned out and they need a day off a week. If you include them in the staff members you'd love to keep forever, then I think you should bend. That's right. It should never be your way or the highway, meaning your way, doctor. You need to be flexible. Maybe they want to take off an extra 4 months with the baby they just had. They don't want 3 months or 4 months off. They want 6 months off or more. Go with it. I mean it. Now, that's trouble for you because you got to replace them. You get one crack at this, and I don't need to tell you any more times than I've been lately, that it goes so fast. When you can look back at your role as the office leader, with, CEO, owner, part of leadership goes beyond what happens in a dental office. I don't have a PhD in it. It's just common sense. When I look back, I think it's one of the reasons I have such good relationships with 99. I think it's a safe number to give you, % of the people that no longer work for me. Because if it wasn't meant to be, then it wasn't meant to be. Like, in other words, I've had people leave dentistry and go on and become like an accountant or a school teacher. Come on, man. How could I even think I'm that important or to try to stop that or talk them out of? Why would I even want to do that? And it leads to incredible loyalty. I mean, coaching a baseball team or a soccer team may not be a little bit important to me at this stage in my life, but I remember when I raced 100 miles an hour, and I think I did, by the way, to get to the baseball field 35 miles away from my office to coach my son's baseball team 1 year, 2 years, and a football. Like, the fact that somebody wanted me to coach a baseball team without even knowing my credentials, except that I had played a little baseball, I don't know, made me feel special that I was in charge of an hour a week or whatever it was of those kids' lives. So maybe that's how this person feels in my office that always had to take off to every spring to coach soccer. And maybe that's how it is for you. So I would bend and give in. And it doesn't make you weak. It makes you a good person. It does. And the last one I'll deal with tonight, because we're into 25 minutes. I try to keep these around that, as you know. And again, this is one staff you're not going to like. They come to you, which happened to me recently, and say, I haven't had a raise in 2 years. What I really want to say to that on the air to you tonight, I can't. Because I shouldn't get angered by it because it's the way everybody thinks, but it does anger me. Time's got nothing to do with it. So you can share this one section if you want. I guess you could share the whole thing with the staff members because time's got nothing to do with it. Are you kidding me? Maybe you haven't had a raise in 3 years. In case you didn't notice, the last year and a half hasn't been really that great for most dentists. Even if it's not a money thing, it's a stressful thing. Here's how you get a raise. I'm talking to the staff. You make an attack, a plan of attack to raise your value. So how do you do that? Well, you take on new jobs. How do you do that? You go to your clinical coordinator or your office coordinator. Is there a cat next to me? There certainly is. Checking my video. I'd leave that in, Beth. It's just Kitty. That's Mo, everybody. I live on the 8th floor of a condo, and Mo has fallen off the top floor twice to the ground, which is, thank goodness, covered by thick grass. Just an aside in tonight's podcast. Told you this was going to be good. I would increase my value by going to the director of the department and saying, what can I do more of here? I want to contribute. I care about this place. Tell me my role. So maybe your hygienist starts doing the ordering supplies or providing the patient education changes that patients read when they are in their operatories considering scaling root planings or getting an oral cancer exam or whatever that is. I certainly have one that does all of that. and more. One of my hygienists has become proficient at Zoom whitening. By the way, none of them asked for a raise when they start doing that stuff. They're just worthy of it because of what they do. You want your value to increase? Be that person in the office, and really be it. You can't like half do this. That he can ask you or she to do something one time, and they know it gets done, no matter what it is. Go to your doctor and say, I know there's a lot of things on your plate. I want to help. I want you to know that I'm the person starting today that you can go to and ask me something. You need to repair a drill sent out for repair. You need something Googled. Whatever it is related to the office, you can ask me and I will get it done. And I'll get it done promptly. Oh my goodness. Right, that might be enough. And then go back in 3 or 4 months or learn something that adds productivity. So can you increase the productivity of the overall office? Maybe take up learning how to do Zoom, learning how to do some model work in the office. Can you improve the morale? Can you do something, bring an idea that is actionable and improve the morale of the office? Can you reduce overhead? Maybe you take on social media postings. I had somebody do that most recently. This is real stuff. Then go back, and then you deserve a raise. You have an actionable plan, and you've added to one of the 3 things I just said: reducing overhead, improving the morale, increasing the productivity of the office. And you have that in place for 3 months plus or more, and you haven't gotten a raise in a few years. Yeah, now we're talking. I'm going to hit you up next week with, what do you do about patients that break appointments? Do we bill them or not? You're afraid to provide oral sedation. That's why you haven't done it. In fact, you're afraid of a lot of procedures. What do? You have a patient in your practice that's just mean. When do you fire them, and how do you do it? You don't have time anymore to work out or do something that you think you should be doing physically for your own health. What would I tell you to do? We're going to pick up with those 4 and more next week on stuff I know you think about, but you're just not sure what to do. Thanks for joining me tonight. I'll see you next week on the Lionhearted podcast. Keep tuning in. I want some more love from Russia or Brazil or somewhere, those places. South Africa. Thank you.